Today we will learn all important questions related to the topic, how to draw blood and make blood smear slide. What is the most common method for obtaining blood samples in physiology lab? Venipuncture is the most common method, where a needle is inserted into a vein to collect blood. What are the alternative methods for obtaining blood samples? Alternative methods include finger stick, heel stick, and arterial puncture for specific analysis. What equipment is typically used for venipuncture? Equipment includes a sterile needle, vacutainer tubes, tourniquet, alcohol swabs, and gloves. How is a finger stick blood sample obtained? A lancet is used to prick the fingertip, and a small drop of blood is collected for testing. When might arterial blood samples be preferred over venous blood samples? Arterial blood is preferred for analyzing gases like oxygen and carbon dioxide or assessing blood pH levels. What precautions should be taken during blood sample collection? Precautions include proper hygiene, using sterile equipment, and disposing of biohazardous materials appropriately. Why is it important to examine blood smears promptly after preparation? Prompt examination allows for accurate assessment of blood cell morphology before potential artifact formation occurs. How is a capillary blood sample obtained from the fingertip? A lancet is used to prick the fingertip, and a small droplet of blood is collected for testing. What is the role of anticoagulants in blood sample collection? Anticoagulants prevent blood from clotting, ensuring accurate analysis of plasma or serum components. Why is it important to properly label blood samples? Proper labeling ensures accurate identification, preventing errors in analysis and interpretation. What are some potential complications of improper blood sample collection? Complications include hematoma formation, infection, nerve damage, or inaccurate test results. What are some questions related to capillary blood sampling? Capillary blood sampling involves finger stick or heel stick methods for small amounts of blood. What are the advantages of capillary blood sampling over venous blood sampling? Capillary blood sampling is less invasive, requires smaller sample volumes, and can be performed more easily, especially in children. When is capillary blood sampling commonly used? It's commonly used for point-of-care testing, such as glucose monitoring for diabetes management. What factors should be considered when performing capillary blood sampling? Proper site selection, ensuring adequate blood flow, and minimizing tissue damage are important considerations. What precautions should be taken during capillary blood sampling? Ensuring cleanliness, using sterile equipment, and proper disposal of sharps are essential precautions. How does capillary blood sampling differ from venous blood sampling in terms of sample quality? Capillary blood may have higher levels of tissue fluid contamination and may not accurately represent systemic blood composition. What are some common tests performed using capillary blood samples? Tests include glucose monitoring, hemoglobin testing, and blood gas analysis. Can capillary blood sampling be used for all types of laboratory tests? No, it may not be suitable for all tests due to potential differences in sample composition and volume limitations. How is capillary blood sampling different from arterial blood sampling? Capillary blood sampling involves obtaining blood from capillaries, while arterial blood sampling involves obtaining blood directly from an artery. How is the collected blood sample typically processed in the lab? Blood is transferred into appropriate tubes, labeled, and then centrifuged to separate plasma or serum from cells. Why is hand hygiene important before blood sampling? Hand hygiene helps prevent contamination of the blood sample and reduces the risk of introducing pathogens. What is the purpose of using sterile equipment during blood sampling? Sterile equipment prevents infection and ensures the integrity of the blood sample. Why is it essential to properly clean the puncture site before blood sampling? Properly cleaning the puncture site reduces the risk of introducing bacteria into the bloodstream and minimizes the risk of infection. Why is it important to use a new needle for each blood sample collection? Using a new needle reduces the risk of contamination and minimizes the chance of needle stick injuries. What is the role of a tourniquet during blood sampling? A tourniquet temporarily occludes venous blood flow, making it easier to locate and access the vein for blood collection. Why should healthcare workers wear gloves during blood sampling? Wearing gloves protects both the healthcare worker and the patient from potential exposure to blood-borne pathogens and reduces the risk of contamination. What steps should be taken if a patient experiences fainting or dizziness during blood sampling? The patient should be placed in a comfortable position, provided with support, and the procedure should be halted if necessary. How should blood spills be managed during blood sampling? Blood spills should be promptly cleaned up with appropriate disinfectants and personal protective equipment. What is a blood smear or thin blood film? A blood smear is a laboratory technique used to spread a drop of blood thinly and evenly across a microscope slide for microscopic examination. What is the purpose of performing a blood smear? It allows for the examination of blood cell morphology, aiding in diagnosing various blood disorders. How is a blood smear prepared? A small drop of blood is spread thinly along a microscope slide using another slide. What staining methods are commonly used for blood smears? Romanowski stains, such as Wright's stain or Ginza stain, are commonly used to stain blood smears. In what situations is a blood smear typically performed? It's performed as part of a complete blood count, CBC, analysis, especially when abnormal cell morphology is suspected. Why is it important to handle blood smears gently during preparation? Handling blood smears gently prevents artifacts such as cell distortion or clumping, ensuring accurate interpretation. What precautions should be taken to prevent contamination during blood smear preparation? Maintaining a clean work area, using sterile equipment, and proper hand hygiene are essential precautions. Why is it crucial to properly label blood smear slides? Proper labeling ensures accurate identification and prevents mix-ups, ensuring results are correctly attributed to the corresponding patient. How should blood smear slides be stored before examination? Blood smear slides should be air-dried completely before storage and kept in slide racks or boxes to protect them from damage or contamination. What steps should be taken to ensure safety when handling stained blood smear slides? Wear gloves, handle with care to avoid staining, and clean spills promptly with disinfectants. What are the different types of anticoagulants commonly used in blood sample collection? Common anticoagulants include EDTA, ethylene tetracetic acid, heparin, and citrate. Why is it crucial to apply appropriate pressure to the puncture site after venipuncture? Applying pressure helps stop bleeding and reduces the risk of hematoma formation or excessive blood loss. How should blood samples be transported from the collection site to the laboratory? Blood samples should be transported promptly and appropriately labeled to ensure accurate identification and minimize the risk of sample degradation. What are some factors that can affect blood smear quality during preparation? Factors include improper slide preparation technique, inadequate staining, or insufficient drying time, which can affect smear quality and interpretation. What common abnormalities can be observed in blood smears? Abnormalities include anisocytosis, variation in red blood cell size, poikilocytosis, variation in red blood cell shape, or leukocytosis, increased white blood cell count. Mention the precautions for handling blood smear slides under the microscope. Precautions include avoiding excessive pressure on the slide, using appropriate magnification, and ensuring proper focus to accurately assess blood cell morphology.